Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, Attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Nicholas Porter, and he's with Behavioral Health of Clear Lake.
Good morning.
Good morning. And so I'm sure my listeners are going, behavioral health, why do I need that? And just as, we've talked to clients before, we have a lot of clients that are not only suffer from, dementia, but also some mental health issues. And so that they had prior to dementia and other things kicking in. So we want to kind of give some balance to and kind of help them because this is a hard subject. So I appreciate you being on, and we're just going to kind of, hopefully get some good information out for our listeners today.
Awesome. No, I really appreciate being here, and I'm super excited to get any information that can be helpful out there.
And so a lot of times, we come at it, from a law perspective, when do we have to have somebody, committed and things like that. Mm-hmm. But where from a normal, navigating, health issues, when does your loved one need to start thinking about hospitalization?
So the real two big indicators that go off when you should really start thinking about hospitalization will be, as far as behavioral, would be agitation. And then something that they're doing in their life would be stopping their medication. Those are the biggest indicators that somebody might need some form of hospitalization. They actually typically couple in with one another. Typically, when somebody stops taking their psychotic medication, they start having those agitation behavioral problems that you typically see come up. So really, that is the time to start thinking about where can I get them to help them get stabilized.
I think for a lot of people, the thought going into a psychiatric hospital is a little frightening, and I think too, maybe for the caregiver too, maybe a little traumatic as far as, oh my God, I've got to take, my loved one because they're we've got to get their meds adjusted, something to help them be able to function in life. So let's kind of clear up a little mystery, so to speak, and talk to us about what's a day like for a patient that's in a psych hospital setting.
So day to day, very different than what you see in your usual hospital, right? So very commonly, especially for somebody who is taking care of another that is in a psych hospital setting, it is a little bit more hands-off than what you are used to receiving in your normal day to day. Really, the patient is kind of on their own. They are in our total care. And how their day looks is typically when they wake up in the morning, they receive a breakfast that is catered to their dietary nutritional needs. After that, they are then offered a kind of group therapy type of class. Typically, this is coupled with other patients that are going through something similar, something that they both kind of have in common. That way, the people can really start to build more of a sense of community with others that are kind of going through some of the same psychiatric issues, mental health issues that they're also are also going through. Typically after something like group, you'll have a little bit of free time. In this free time, that's kind of where patients do many different types of CRTs, so certified recreational therapies, and those can vary day to day, right? So differences in like art therapy, music therapy, pet therapy, nature therapy, things like this that are offered to the patient, not necessarily mandatory for them to do, but something that will help them, that really helps bring down helps stabilization. Also at that time, typically we serve lunch. Food is definitely big in psychiatric hospitals. Everybody loves to eat. Everybody loves to have the sweets, and we love providing. Typically after lunch period, that's when you are meeting with your case manager, your discharge planner. We like to have, whenever you're coming in for a stay, at any psych hospital, you should be thinking about what's happening after. What is going to be happening after I leave this facility? So every single day in your stay, your case manager is working with you to figure out, do you need a therapist? Do you need a psychiatrist? How can we set you up? What insurances do you have? And what can we set up for you? Where can we refer you out? Typically following that, a little bit more free time followed by dinner, and then another session of group therapy. So really, it is a lot more of an involved process. Your loved one is being constantly looked after. Typically with patients, it is a one-to-one care, meaning they are receiving individual attention almost at all times during their stay. So it is very different. We definitely understand that coming into a different type of hospital setting, there are lots of questions. And the biggest thing that I can say to any loved one that is about to have a patient hospitalized is bring us all of the questions. There is no question that'll make us feel uncomfortable. It is our job to make sure that not only does your patient feel uncomfortable, but that you feel comfortable as well.
I think it's important for people to understand that, asking questions, is important. It's not because you're stupid, it's because you don't know the information, and the only way to get it is to ask questions, so that,
Amen.
yeah, so that's really, really important. And in that, but sometimes that people have challenges when they're finding placement. So how do y'all help with that?
So some of the challenges that you find with that you're kind of faced when finding placement typically are transportation and specific service. So with most psych hospitals, they will take straight psych patients, but then they also specialize in a different type of mental health care, which ranges from adolescents to outpatients to more medically acute patients. So really finding that specialized hospital that's going to be the best fit for your loved one can sometimes be a little bit difficult. So things that we do to try and help with that are things like this, right? We're just getting the word out, letting people know that we exist. A lot of cases, especially when it pertains to mental health facilities, there are big networking groups that happen throughout states and counties that are there specifically designed to set up to help you locate that specific psych facility that's going to be perfect for your loved one. The next biggest challenge that's typically faced then, and these two also sometimes couple together, is then transportation. Sometimes it can be difficult navigating transportation to and from different mental health facilities, especially as it pertains to a psych hospital. Every single psychiatric hospital will be working with what's called CIT, crisis intervention teams. They are teams that are designated licensed mental health agents and police officers that assist you in kind of the transportation of your loved one to a facility. Post, typically upon discharge of a facility, then and only then is the psych hospital allowed to assist with transportation home. So we try and meet you halfway there. If you can find a way to help us get you there, we will find a way to get you home.
That's good. And so I tell a lot of clients, what's really important is knowing the phone number to your mental health deputies. It's not a matter of necessarily calling 911 because, while they're doing better to train police officers in how to handle mental health, your mental health deputies, and they're in the sheriff's department, constable's office, all across the state, and they're specifically designed to go out and help navigate that transportation if you need, if they're a danger to themselves and others. And so I used to tell clients, here's, if they had an issue, it had a loved one that had mental health, here's the phone number you need for your county. So you put that in your phone and you hang on to it. So if something goes wrong, this is the number you need to call.
I think a big thing to remember there as well is that it's not like you're calling the police on your loved one. You're calling a mental health professional that is just there to help you escort and help stabilize.
Yes. And so, because some of it can be pretty frightening, so without having, somebody there that's really trained to understand how to navigate that dangerous situation potentially at home and get into the care that they need. And so, but let's say I'm the caregiver, so what can I expect, for someone that's in the hospital?
As the caregiver, kind of tailing back to something I had said before, it is a completely different setting than your typical just straight medical hospital. When you bring your loved one to our doors, we understand that you as the caregiver have been carrying a tremendous amount of weight on your shoulders. And it is now our job to carry that weight for you, however long your patient or your loved one is with us. So in that way, the biggest thing that we recommend for caregivers is, one, have your ringer at the ready. Patients love to call their loved ones, check in, tell them how they're doing, how their stay is going. So definitely be ready for phone calls. And the next biggest thing, the biggest thing that we tell all loved ones is this is now the opportunity for you to take care of yourself, for you to go out, get that extra sleep you need, run out and get those groceries that you've been putting behind, catch up on those bills. This is kind of your opportunity to know that your loved one is in a secure facility with people that are constantly checking in and truly are devoted to caring for your patient, for your loved one.
Oh, that's good advice. And so, because a lot of times it's very difficult for families to leave them, knowing that they're going to go and they may not see them for a little while till they get stable and things like that. And but let's talk about the people you have in place that do help that. So, talk to us about patient advocates and why they're so very important in a psych hospital setting.
Patient advocate is a huge role for any loved one that has somebody in any psych facility. How the patient advocate role works is that they are really the communicator for your loved one while they are in our care. So they are the person that goes in every single day, most of the time, multiple times a day, to make sure that not only do they understand what is going on medically, but what is going on throughout the facility as well. So they make sure that you have a total understanding of what is going to be happening, what is going to be going on during your stay. And they're also really more of a listening ear. They want to hear any problems that you have, any form of discomfort that you're feeling, because they are the people that can really get to it and handle it quick, right? You do have nurses and behavioral health techs that are there really helping your psychiatric and medical needs. Your patient advocate really handles the additional, the above and beyond, the comfort, right? Do you need an extra pillow? Are the blankets not warm enough for you? Things like that, as minute as that, as to going over what your medication breakdown is going to be and where you can expect to receive that medication upon discharge. Typically, a patient advocate is, in my opinion, someone that has a huge heart. They are all very, very kind, and they are all very open to communication for you as well. So it's a random Saturday night and your loved one has been in care and you're just thinking about them. You're just loved and concerned. You can call your patient advocate. Hey, can you check in on them? Hey, can I just get a phone call real quick? Would you mind waking them up? So really, whenever you go into any psych hospital, highly recommend that you immediately ask for your patient advocate's phone number. They love speaking to family members. It is their job to bridge that gap for you while we have total care.
So that's new for me. Did not know that exists. So that I appreciate immensely. And so because I think that it's a scary process, that when you've got a loved one that needs hospitalization, that's really scary. So, having that patient advocate that can be there so you can just pick up the phone and say, are they doing okay?
Yeah.
And do they need anything? Can I bring them anything? What can I do? So that at least helps, the person that's been that caregiver taking care of them, give them the ability to at least feel better about doing something when they can't do anything, because that tends to be a really big issue as they feel so helpless. And so just having someone there that can kind of walk them through that process is great.
It's our job to make your loved one stabilized and to make you feel at ease. And that's, where no matter the position, no matter where you go, that is the destination of every single psych hospital, psych facility that you'll ever go to. We want to care for your loved one and we want to care for you as well.
Yeah. Well, I know you have a good place there in the behavioral care of behavioral health of Clear Lake. So I know you have a good facility there. But if someone wants to get in touch with you, how do they do that? Because you're very passionate about, about talking. And so it really comes across. So if somebody, just would like to talk to you or maybe get some information about behavioral health of Clear Lake, how do they do that?
Of course. So you might see on the screen some of my information popping up. The best way to reach me will either be my email or my phone number, which is 678-910-1549. That is my personal phone. Feel free to give me a call any time of the day or night. Any direct questions pertaining to the hospital, my facility directly, please feel free to give our hotline a call at 877-398-4186. Our intake department is incredible. They will also help answer any questions that you might have.
Perfect. And Nicholas, this has been great. I like getting new information, and I really like being able to get it, to our clients and their loved ones who are listening. They may have someone that has these kind of behavioral issues that, sometimes they just need a little time to get, meds adjusted and, get them back on track. And so it has been a pleasure meeting you today, and we look forward
to it's been the pleasure's all mine. Thank you so much for having me on today.
And so, well, we look forward to having you on again soon. So you take care, hon.
Thanks, you too. Bye.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcasts as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.